Assalamualaikum and good morning. Here is our video assignment which is about ultrasound. But before that, we would like to thank our lecturer, Dr. Hashima, for teaching and guiding us this subject. So before we start it, let's watch this animation video.
Before you were born, Dr. Yan used an ultrasound machine to look inside Mom's belly to see you. Ultrasound is a very high-pitched sound, so high you can't even hear it.
Oh, you mean like a dog whistle. I've got one of those somewhere.
Sorta, but even higher than that. Even dogs can't hear the kind of sound that ultrasound machines can make. The tool that the doctor uses has a probe, that thing in his hand, that puts out these really high-pitched sounds. These sounds bounce off things inside of people, and the machine can turn the bounced back sound into a sort of picture of the stuff inside. See? There's your head, and there's your heart beating.
Oh, huh. Well, if that's me, they sure didn't catch my good side.
Yeah, actually I think they pretty much did.
Oh, well, hey!
Ultrasound or ultrasonography is a medical imaging technique that uses high-frequency sound waves and their echoes. Ultrasound, also known as a pulse echo technique. Moreover, ultrasound also is a high-frequency sound wave. Ultrasound wave can be bounced off tissue by using special device. The echoes are then converted into a picture called a sonogram. Ultrasound imaging allows an inside view of soft tissues and body cavities without the use of invasive technique.
Purpose. Most people excited ultrasonic scan with pregnancy. This scan can provide an expert mother with the first view of her unborn child. However, the test has many other uses. The doctor may order an ultrasound if the patient having pain, whealing or other symptoms that require an internal view of the patient organ. Okay, next for procedure. An ultrasound technician, it will be apply a special lubricating jelly to our skin. This prevent friction. It can be rubbed the ultrasound transducer on our skin. The transducer has a similar approach to a microphone. The jelly also help transmit the sound wave. The transducer send high frequency sound wave through the body. The waves echo as they hit a dense object, such as an organ or bone. Those echoes are reflected back into a computer. The sound waves are at too high of a pitch for the human ear to hear. They form a picture can be interpreted by the doctor.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Taufik Kasri. So today I will explain about the result of ultrasound. And ultrasound scan usually takes around 20 to 50 minutes depending on the type of the examination we do. So the result of the ultrasound scan are usually sent to the doctor. So we will have to make a follow-up appointment with them to get the result. As we can see, the fluid is always black and tissue is grey. The denser the tissue, the brighter white it will appear in ultrasound, the brightest white being born. So this is the example result of lung ultrasound. As we can see in the picture, the left side of the picture is longitudinal scan and the right side of the picture is transverse scan. Longitudinal axis usually refer to scanning in a plane parallel to the structure, while transverse axis refer to scanning in a plane perpendicular to the structure. Next, this is normal lung from the ultrasound examination. The A lines is actually horizontal artifactual repetition of the pleural line displayed at regular intervals. After that, this is the example result of pregnancy ultrasound. On the left image, there is enhancement. This is when part of the structure being examined appears brighter than it should due to an excess of fluids in the area, such as in a cyst. On the right side of the image, attenuation, also known as shadowing. This effect causes the area being scanned to appear darker than it should. On the downside of the image, anisotropy. This effect has to do with the angle of the probe. For example, holding the probe at the right angle to do some tendons would cause the area to appear brighter than normal. So it is necessary to adjust the angle of the probe to avoid this effect. Then, on the left side of this image, for example, this image is the example of pregnancy ultrasound. At 8 weeks, the fetus will look something like a gummy bear or a baked bean. For the pregnancy at 12 weeks, it may be able to identify the head of your baby, and at 20 weeks, it is able to see the spine, eyes, feet, and the heart. A 3D ultrasound, can show the baby's facial features, and it may even be able to detect certain defects such as cleft lip and the palate. Also, ultrasound can do a 4D, but a 4D scan makes a short video recording of the baby in the womb. So, if you want to have a 3D or 4D ultrasound, the best time to do is between 26 to 30 weeks.
Assalamualaikum and good morning to Dr. Shima. My name is Muhammad Daniel Hakim bin Muhammad Yusuf, and now I will explain applications of ultrasounds. Okay, let's go. Okay. Sound wave is a wave frequency higher than the upper audible limits of human hearing are called ultrasound. And second, the properties is similar to the normal audible sound. And the third concept used in many different fields, which is, for example, cleaning, echocardiography, ultrasonography, detection of cracks, sonar, and echolocation. Okay, so next, first is cleaning. In objects with parts that are difficult to reach, so example spiral tubes and electronic components like a smartphone or power bank. And third, object is dipped in a solution of suitable cleaning material and ultrasonic waves are passed into it. So the result of this the dirt and grease to detach from the surface. So next, echocardiography. So basically, echocardiography is ultrasonic waves are used to form an image. So by using reflection and detection of this wave from various parts. So this is a figure, echocardiography. So next, for the third, ultrasonography. So the first is diagnostic imaging technique based on it, and second is use of imaging of internal body structures such as muscle, joints and internal organs, and the third, which is a process, pulses of ultrasounds are sent to the tissue using a probe where different tissues reflect sound varying in degrees. And fourth, detection of cracks, used to detect cracks in the metallic components and generate and display an ultrasonic waveform. And third is by using the aid of analysis software to locate and categorize flaws or cracks, and the result of this, a trained operator will identify which part area are cracks. So the fifth is sonar. Sonar is stands for sound navigation and ringing. So the technique that uses sound propagation, usually underwater, as in submarine navigation. And for the last is echolocation. So the first is process where sound waves and echoes are used to determine objects in space, and usually used by pets to navigate and find their food in the dark. So they will send out sound waves from their mouths and then hit the objects in their producing echoes, also help them to determine the size of objects and distance. Alright, so next I will pass to the next presenter. Thank you.
As the discussion, ultrasound is safe and painless. It produces pictures of the inside of the body using sound wave. Ultrasound imaging is also called ultrasound scanning or sonography. It uses a small probe called a transducer and gets placed directly on the skin. High frequency sound waves travel from the probe to the gel into the body. The probe collects the sound that bounce back. A computer uses those sound waves to create an image. Ultrasound exams do not use radiation as used in X-ray because images are captured in real time. They can show structure and movement of the body's internal organs. They can also show blood flowing through blood vessels. So for the conclusion, ultrasound imaging is highly focused on the acoustic impedance of various mediums. The waves of sound that are reflected back to the detector in the transducer are converted into graphs and then to a clear 2D image.